Hello, I'm Guinevere Catchings-Hess, President of the Black Women's Agenda. Welcome to our virtual podcast, I Am the Change, addressing COVID-19 here and now, National COVID-19 Public Education Campaign. We have a wonderful panel to discuss the COVID-19 situation in our community. Our first panelist is Dr. Melissa Clark, a Harvard-educated emergency physician who is known for quality health and health equity for Fortune 500 companies and multiple healthcare organizations. She authored the popular book, Excuse Me, Doctor, I Have What? To empower healthcare consumers, and facilitates a weekly streaming show of the same name. Dr. Clark is a leading voice in the fight for health equity in the Black community. She serves as a medical advisor to the Leadership Council on Healthy Communities and is an originator of the Virtual Health Ministry. Our next panelist is Dr. Martha Dawson. Dr. Dawson is a nationally and internationally recognized as a global thought leader in the field of nursing and healthcare administration. She is a current president of the National Black Nurses Association. Dr. Dawson is an associate professor at the University of Alabama at Birmingham School of Nursing in the Division of Nursing and Healthcare Leadership and the Nursing Systems Administration. Our next panelist is Dr. Sarah Killian. Dr. Killian is a nationally recognized nurse leader in education, administration, and practice. She holds a Doctor of Nursing practice degree and is board certified as a nurse executive. She is currently retired clinical associate professor from a 14-year stint at Georgia State University, where she was instrumental in designing and implementing the Doctor of Nursing practice program. Although Dr. Killian completed her career in education, more than half of her career in nursing was employed in the practice setting as a nurse administration and clinical nurse educator. Dr. Killian is the national president of Chi Eta Phi Sorority Incorporated. Welcome to all of you. We're so happy that you're here with us this evening.
Thank
So
you.
let's get started. Let's start with, let's say, Dr. Dawson. Establishing vaccine confidence is vital to the effort to end the pandemic. But we all know in our families and with our friends, there is some hesitancy in the community about getting the vaccine. People hear and see a lot of mis and disinformation on the social media and in the social circles. But what are some of the things that can be done to help our community move from vaccine hesitancy to vaccine acceptance? I know I was talking to a relative last week, and he was not, I hate to admit that he was not vaccinated, and I could not get him to say that he would be vaccinated. And so I was losing my patience. But I know we aren't here to talk about my patients, but it would be great to know what can we say or tell them about how important it is to be vaccinated. Dr. Dawson?
Again, thank you for having me this afternoon. I really have been talking about this subject ever since they started talking about the vaccine. And that is, we have to meet people where they are. First of all, listen to them. And then begin to listen very closely to see where they may have some misinformation. Because we know everything has been on social media. So there's a lot of misinformation out there. And I think misinformation is someone out there just giving out information and they don't know that they're giving wrong information.
Mhm.
Disinformation is when someone know that they're giving wrong information and they don't care. So I tried to ask people, okay, tell me what you know about COVID. Then while they're explaining, I'm listening to what is true and what isn't. Because what we have to do is move people from that space where they are uncertain about, COVID. And sometimes you just have to use common sense conversation with them. So although I'm a nurse, I don't try to use a lot of medical terminology when I'm talking to someone one-on-one or either in a group or just educating, because it's important that I move myself down where they can understand what I'm saying. So for example, I have said to people, so explain to me why, if you are feeling bad, you will go to the physician. Do
Mhm.
you always know what that physician is giving you? Do you know really how long it's taken for them to develop that medication? Because everybody says, oh, they developed the vaccine so fast. So when you begin to ask them those questions, they may say no. So you begin to move them to that area of now ready to listen. When they're ready to listen, you can give them more data. And eventually they may move to that level of acceptance. I never judge anyone. So I never say to someone, you should just go get this. I really want to move them to that space where they feel comfortable that they should. So you have to talk about the risk factors as well. These are the things that could happen if you don't get vaccinated and you end up with COVID. So you just have to meet them where they are, give them enough information at a level where they can understand it.
Great, thanks. Dr. Killian, do you have friends or relatives that you persuaded or needed to persuade?
Yes, I have. And I thank you also for having me here this evening. It's a pleasure being here. I have had friends and relatives. Fortunately for me and for them, we've developed relationships and they have somewhat of a trust factor in the things that I say. But I have people also who have hesitated, and I don't want to tell on anyone, so I won't say some of those important people to me who have not listened to me. They've made up their minds about it. But the bottom line is, first of all, I've had older friends to call me and ask me about it. So I explain to them, I meet them where they are, explain to them what the vaccine is about. I also tell them I took the vaccine.
Mhm.
And I also talk about the risk versus the benefits of the vaccine and the choices that they have in taking it or not taking it. So I've experienced some of the same things that Dr. Dawson has experienced in the community, your friends, your relatives, knowing that you are a nurse and they ask you, so you try to meet them where they are and explain it on their level so that they will understand it.
Terrific. Thank you. Dr. Clark, you are a celeb with your own show. So how are you approaching COVID in your approach to communicate with people about the disease, about the pandemic?
Absolutely. Well, thank you for having me. So I do have a show where I take questions live on the air, and I've been doing that for the past year and a half. And since the vaccines have been available, I've of course gotten lots and lots of vaccines, seeing questions, and also have to wade through the disinformation and the lack of understanding of how the vaccine works and all those kinds of questions, as
Mhm.
well as the active lies that are, that are in circulation, unfortunately. And just as Dr. Dawson said, it's important to acknowledge that we, as African Americans, are from a traumatized community. We've been traumatized by the medical system, and it's important to get that out there and put it on the table, and then move on from there to say there are a lot of things that we expose ourselves to that we have no idea what's in them. And the example I like to use is tattoo ink. Especially younger people have lots of tattoos, and that's something that's injected. There have been no long-term studies on tattoo ink. It's not even FDA approved, but people willingly subject themselves to that, and there's really no gain for anyone else other than the individual. The other thing that I really think it's important to emphasize is that, again, we in the African American community have always had an ideal of community and understanding that I am because we are, right? It's really more of ideals from other cultures that only talk about that rugged individualism, and it's a personal decision. And it's anything but a personal decision when you're talking about an infectious disease that spreads like wildfire, and my own personal behavior impacts so many other people. And so I also try to help make those connections. I use a lot of analogies as well. So, for example, I talk about the fact that when the mRNA, the genetic information inside the vaccine gets into your cell, it gets destroyed like a Snapchat. Or for people who are older, I talk about Mission Impossible. This tape is going to self-destruct in 5 seconds. And so after it delivers its information, there's nothing left there to cause really long-term damage that people are concerned about. And so those kinds of analogies sometimes help folks understand the more complex nuances of how the vaccine is actually working.
Well, I'm the Mission Impossible generation, so thank you for putting it in terms that even I can understand. So thank you for that. But don't you wonder how, and this is to all of you, how it even started, that somehow they will be able to trace you and track you and find you in different ways. And your cell phone is the best way for anybody to trace you and track you for anything. And can you talk to us? Have you come across people who are concerned that this foreign object is entering their bodies and they can't control it?
Absolutely. I'll be happy to answer that. So yes, I do a segment on my show each week called the Weekly Debunk. It lasts about 2 or 3 minutes. I take some piece of misinformation like that and I explain in layman's terms why it's inaccurate. But we have to understand that a lot of this disinformation, there was a study done out of University of Maryland, the Center for Health Equity, and they looked at going back tweets and posts on Facebook 5 years ago. And that this predates the pandemic, obviously. And it showed that there was an anti-vaccine sentiment, and it was being propagated by the same Russian bots and trolls that influenced the 2016 election. So there's been a lot of actual intentional misinformation that targets certain communities, and the communities that are most vulnerable are the ones who have been traumatized. So you take the seeds of disinformation, you put it in that rich, fertile soil of concern and mistrust of the healthcare community that's been earned over time. And that's where the weeds and the wildfire takes off, unfortunately.
It's so true. Dr. Dawson?
Yes, I was just going to add, again, this is a great opportunity to educate individuals because I've been informed and that question has been asked. And what I usually explain to people is if the government wants to get to you, they can. They have all of the information to do so from the time you're born, because they will not allow you to leave the hospital without a name and a birth certificate. And that is registered. And in addition to that is with all of the technology we have now, all I need is your name and your address, and I can get a bird eye view of where you live, what your house look like, the color of the house and everything. So all of that, when you explain to people, say, go put in your own address, go out there and find yourself. If you can find your house, your location, then guess what? Anyone else can as well. So let's move away from all of the hype about, oh, this is putting something into your system and this is going to do that. And then I go and I ask the next question and say, so if you become very ill, where are you going? If you really start feeling bad, you really start feeling sick, what are you going to do? I'm going to go to the doctor.
Mhm.
And I'm saying, and when you're feeling that bad, do you know what that physician is doing to you? No, you don't. When you
Yeah.
go to the emergency room, they're doing some of everything. When they take you to the ICU and start hooking you up to a ventilator, putting fluid in it, you don't know what they're giving you. So let's just get rid and debunk all of this information that doesn't make sense and move yourself back to reality and say, how many people do I know have been vaccinated and they're still walking around? Then that's when I also share that I've been vaccinated. I've had all three of mine, and bless my physician, primary physician Hart, when I went to see her on December 17th, she said, it's time for your flu shot. I'm just going to give you a double dose. You know, I'm thinking if anything get in this body, it's probably going to want to fly out, you know, but yet still, I prefer to be vaccinated, you
Right.
know, rather than take the risk of getting COVID, becoming severely ill, end up in an acute care facility, and then don't know what people are doing to me. I think that's important. And the other thing, and I'm going to shut up and give someone else to speak. I have spent a lot of time trying to explain to individuals that COVID-19 is a public health illness. And that's why we try to control it outside of the hospital by saying, wash your hand, wear your mask, go ahead and get vaccinated. It is once you get COVID that you don't know how it's going to interact with your body that leads you into a hospital, whether it's the emergency room, the doctor's office, or wherever. But if we can do this right, we wouldn't have to get to that point where we have to keep talking about how many hospitalizations and how many people have died.
Mm. Thank you. Dr. Killian,
Yes.
can you talk to us about your Al-Qaeda Phi and what you're doing, your organization is doing to help people know that they should get the shots?
Okay, yes. Chi Phi Sorority Incorporated is a service organization of professional registered nurses. Therefore, it is incumbent upon us to educate the community. And that's what we were founded on, and that's what we've been doing for almost 90 years now, is going into the community, meeting people where they are, helping them to understand different illnesses, different diseases, COVID being one of them, understanding how it affects the body, what it will do to them. And it is done on the local level, on the regional level, as well as the national level, with the education piece to bring that to the community in a environment that is comfortable for them. They're seeing people who look like them. They build trust with those people, and we share stories and help to educate them about the disease and what it can do. And I will tell you, when asked, I just get down to brass tacks, to coin a phrase. You have two options. I've had people to ask me, well, I don't want to take the vaccine. I'm afraid of it. And I said, well, okay, you have two options. You can take the vaccine and get better or not get as sick, not have to be hospitalized, or you can choose to die. And those are your options. And I told my sister that, who is 10 years older than I am, and she understood exactly what I was talking about. So educating the community and explaining to them on their level about the disease, about the treatments, and about being healthy and having better health outcomes is what we do with COVID.
So tell me about the venues when you're going out in the communities. Where do you go, and how's your approach to getting the word out?
Okay, the venues, we've been doing since COVID, we've been doing a lot of virtual education. We also, our organization, we have programs and projects, and we teach across the lifespan.
Mhm.
Therefore, with our programs, our projects, we utilize those opportunities at education at the schools, education on the older adult level, education on the just across the age spectrum is how we do it. So we go into some of those places, of course, using social distancing, hand washing, mitigations as advised by CDC, but we are able to go in, we teach them about utilizing masks, we teach them about the vaccine, we teach them about the disease. So we go to them, and sometimes we do it virtually.
Great. And so I'm going to find out about what's going on with the National Black Nurses. I'd like to know that also. But before we do that, can you, if someone wants to contact you because they'd like to get more information, how can they do that?
We have a national website. They can contact us through our national website. And again, with the partnerships that we have in the community, they have ways of contacting us as well. Like when we go into the long-term care facilities and do education, when we go into the school system, we have contact information that's provided that way too, but also on the national website. They can get information how to contact the leadership of the organization and or members.
Okay, Dr. Dawson, tell us about what your organization is doing.
Okay, the National Black Nursing Association, and you can contact us at www.nbna.org. Again, we have been in the community starting April the 1st, as soon as the pandemic was announced in 2020, and we have not stopped because we was in the community prior to the pandemic. So when the Black nurses showed up, people knew us already. And many of them was calling on us. And it was interesting because I was on a meeting with Dr. Regina Benjamin, our previous general surgeon under Obama. And we was talking in conversation, and someone said something, and she just piped it. She said, "Oh my God, those Black nurses are everywhere." I gave a thumbs up. We should be everywhere.
Yeah.
But I would tell you that I have chapters in 34 states plus the District of Columbia. We have a total of 111 chapters. And again, they have been busy doing everything from educating to actually getting shots in the arm. I have one of my chapters that have given just one single chapter over 7,000 vaccinations. I have my Miami chapter. They are right out there giving it, but they are focusing a lot on the homeless population, as well as going into women's and children's shelters to make sure that they're getting vaccinated. We have also been in the incarcerated population, making sure that they're out there. When the school started back in September, I would say right around about October, so we started hearing about schools that was running out of PPE supplies. So we targeted 5 different states in the Southeast. That was Alabama, Florida, Georgia, Louisiana, and Texas. My 12 chapters in those states literally adopted 110 schools. We literally gave out supplies 118,000 plus. Everything from masks to gloves to hand sanitizer to wipes for the teachers to use in the school desk. We found out there were some bus drivers were picking up kids without masks, and we literally sent like 500 masks to that entire I'd say school system. So again, it's kind of like wherever the needs are, whether it is a webinar such as this. Actually, I'll be joining one tomorrow for about 4 hours that we're putting on that's focusing all on pediatrics. We have done things focused just on men's health, so that we can bring in our fraternities with us and also our sororities. So we have been partnering with the National Council of Negro Women. We've been working with the Deltas and AKAs and everyone else that we can reach out to, faith-based organization. whether they are the Southern Baptists, the CMAs, the AMEs, the Church of God in Christ, you name them, we're there. And some of them I probably will get those acronyms all mixed up. But all they have to do is call us. Because again, we take this very personally because we know that our population, as well as other Black and Brown communities, have been suffering from this. And so we are out there in the community, and the other things that we do too is we work with food banks, because during this time we want to make sure that our elderly and our children have at least some fruit, vegetables, and other things that they need. So we're not just out there around the Christmas holidays, but we're around there at other times too, trying to address that food insecurity if we can.
Wonderful. Well, thank you. Dr. Clark, let's talk vaccine.
Yes.
And is there a difference between the third shot and a booster? Or are they all the same? And who should get a booster?
So practically, when it depends on which vaccine you're talking about. So the Pfizer vaccine and the Moderna vaccine, the third shot is the same as the booster. But if you're talking about the Johnson & Johnson, which started out as a 1-dose vaccine, it's really now a 2-dose vaccine, and that would be considered a booster. And so it's also important what age you're talking about. So anybody who's 5 years and older, so 5 to 18, can get the Pfizer vaccine. And then, the eligibility for the Johnson & Johnson and the Moderna is mainly for adults. For boosters, anybody who is 12 and over can now get a booster dose of the Pfizer. So if you're 12 to 17, you can get a booster dose of the Pfizer. And then if you're 18 and over, you can get your second dose of your Johnson & Johnson vaccine if it's been 2 months or more. And for the Pfizer and Moderna, it's if it's been 5 months or more.
Now, I have a friend who's had the 4th dose.
Yes. So that's for individuals who have poor immune system function. So their immune system doesn't do the job of making antibodies as effectively as everyone else's. And that could be for a variety of reasons. They may have an underlying chronic illness. They may have a cancer of the immune system, like as we saw with General Colin Powell, who had multiple myeloma, which is a cancer of the immune system, so it can't make antibodies. It could be because they're on a medication that suppresses their immune system. So they're getting treated for cancer, or they're taking steroids for asthma or an autoimmune disease like lupus or sarcoid, or they're on what's called a biologic agent. The same thing, it suppresses the immune system for people who have autoimmune diseases like sarcoid and lupus and rheumatoid arthritis. So all those individuals would fall in that category of having a suppressed immune system, or one that doesn't work well. And so they would be eligible now for a 4th dose.
So the monoclonal antibodies, they're saying that they're not working that well, or don't work at all, actually, for the Omicron variant. Can you talk to us about that? Or
yeah, so let's take a step back and talk about what are variants and why are we seeing these things. So every time a virus, any virus, gets into your body, its job, what it's there for, is to make more viruses. And it takes over your cell's machinery in order to do that. Well, in the manufacturing process, sometimes mistakes are made, changes are made in the makeup of the virus. Those things, changes, are called variations or variants. Every time somebody gets an infection from COVID-19, they are a potential source of a variant. So there've probably literally been millions of variants that have happened, but only a few get an advantage due to these variations that pop up. The advantage being they can either get around the antibodies that have been formed to previous infections or to the vaccine, that's what happened with Omicron, or they might be more deadly. And so we saw that with Delta. It appeared that with Delta, it made people sicker. So what happened specifically with Omicron and the antibody cocktails, those are manufactured antibodies in a lab that people receive monoclonal antibodies if they were at high risk for getting a severe case of COVID. And so Omicron, unfortunately, was able to get around those antibodies, all except one brand of antibodies by GlaxoSmithKline. So those are still available. Unfortunately, they're not in wide production. So it's been difficult to get them, but those did still do the trick when it comes to suppressing the Omicron variant. And then as far as the vaccine goes, all 3 vaccines, if you've gotten the full series, and especially if you're boosted, have been super effective at keeping people out of the hospital and alive.
Mm. Let's talk about the importance, though, of wearing a mask and avoiding being in mass gatherings. And what can one do if one has to say, take a trip on a plane? What types of precautions should one take?
Mask. So, that the air and the other things about indoor gatherings, it's the density of people, the inability to social distance, the quality of the air. Is there air coming in and circulating or being taken out of circulation so that you have a lesser chance of breathing in the virus? So when you're traveling and you're on the airplanes do a pretty good job of recirculating the air, but of course you're pushed in there like a sardine can, right? So it's important to wear a high quality mask, a KN95 mask or N95 mask. I know a lot of people are stuck on their cloth masks because, they have the sequins or they have your favorite logo, but they're not really effective. They're really only a stopgap until we were able to manufacture enough of the high quality masks so that everybody could get them. And if for some reason you find yourself with a cloth mask, it's important to double mask. Wear a surgical mask underneath, plus your cloth mask and a filter layer like a paper towel or something in between. But again, that's still not as good as the N95s and the KN95s. And then of course we heard hand washing, not touching surfaces and touching your face. That's still, it's not as frequent a way that COVID is transmitted, but still important to observe hand washing and good hygiene.
If you truly don't believe in the vaccine, you do really need to practice these other health precautions, not only wearing the mask, but also just staying away from crowds, staying at home, because see, when I wear the mask, I'm protecting you, but when you're not wearing a mask, you're not necessarily protecting me, and I think the other thing that people have to understand is the things, people are complaining about, we should have been using good hands hygienes all along.
Yeah.
And we had already started a campaign with the young kids, even in preschool. When you sneeze, what were we telling them to do? Do it in your elbow. I can remember my little 4-year-old nephew going around the house before COVID. If he sneezes, he'll do this, and if someone else says, he'll tell him, you're supposed to do this. So these things are not new. And I just think that, again, if I know that I'm unprotected, let's try to protect others, and don't keep putting yourself at risk and then putting the rest of your family at risk as well.
Right.
And that is just so extremely important. And we are fortunate that we do have all of these readily available modern things that we can use. Just think about if this had happened 60 years ago, there was still so many people without running water in their home and without inside bath facilities.
Mhm.
We would have really had a bad outbreak of this. So we're blessed to have these facilities. So let's just use them and use common sense about if I don't want to be vaccinated, then as my mother would say, sit yourself down somewhere.
We had the same mother, and I didn't know that.
Okay.
Dr. Killian, talk to us about some of the things that you've seen out, sort of out in the field, in the communities, in the hospitals, and with people with COVID and their struggles, as far as survival is concerned, and if someone can tell us about what the conditions are in the hospital for people who don't have COVID and they're trying to even be able to get rooms in the hospital that they can't, because it is not only affecting people with COVID, but also affecting people who don't have COVID.
Yes. First of all, we've been talking about how important vaccinations are, and they are extremely important. And because people are not being vaccinated, those are the people that are being hospitalized. The statistics are showing that the unvaccinated members of our society are the ones in the hospitals. COVID has been going on now for over 2 years. It is extremely hard on the nursing staff. They're working extended hours. They're having, even on our newer nurses, I will tell you, I have a new graduate that's in the family, and she's been out of school for about over a year and a half, getting close to 2 years. And she's worked on a COVID unit, and they have to continue to flip units from being a regular unit to a COVID unit because of the numbers that are going into the hospitals. She's exhausted, and she's thinking about going out of nursing. We have a nursing shortage, and that nursing shortage is because we have a shortage of nursing faculty. So we cannot educate more people to become nurses. So in the hospital setting, you have a shortage of nurses. You have sick patients that have to be isolated. You have nursing staff that have to, for lack of better terms, almost put on hazmat attire to take care of those patients. And they're working long hours. They're being asked to work additional hours. So it is overwhelming the hospital systems. And if we could get more people vaccinated, it will be a great thing, because those people are not getting as sick as those who are vaccinated and do not go into the hospitals. So if you are crowding your hospitals with COVID patients, then all of your other types of surgeries are being, those elective type surgeries are being put on hold. If your emergency rooms are crowded with COVID patients, sick patients, then what happens to those patients that go in that may possibly be having a heart attack, or may possibly be having some respiratory problems outside of COVID because of other underlying conditions that need to be taken care of? So it is really putting a lot of stress on the hospital system, on the hospital staff. Nurses are talking about they're not sure whether they want to stay in nursing because it is truly taxing the nursing staff. And administration is somewhat caught in a catch-22. When the patients arrive, you have to take care of them. So what do? You take care of the sickest patients first. So we are truly encouraging people to get vaccinated so that if they by chance should get COVID, they will not have to be hospitalized. It will be milder cases of hospitalization, as well as the boosters to help build up that immune system so that they won't have to go into the hospital. But it is very taxing on the hospital staff.
If I could jump in, I have a personal story. My father-in-law fell and broke his hip on New Year's Eve. He's been in the hospital, and now he's in rehab. When he was in the hospital, in the ICU, nurses normally only have 1 or 2 patients. Because of the nursing shortage, there were 4 patients per nurse. There was not enough respiratory therapists, so he required some respiratory services. Hours would go by before a respiratory therapist could show up. When it was time to transfer him to the rehab unit, an outside rehab hospital, there were no beds, because people who have COVID have rehab needs too. So fortunately, if they get through their hospitalization, they need rehab to learn how to breathe again, to get their strength again. So there are no rehab beds. So it's the nurses are the backbone of the healthcare system, but it's all facets of the healthcare system: the doctors, the respiratory therapists, the housekeeping. They're 1 in 5 healthcare workers are quitting because they're burnt out. And there's even something called compassion fatigue. And you can imagine that if healthcare workers run out of compassion, how that's going to affect the quality of care that they're giving people, because they're just tired of a preventable illness, having people flood the hospital and watching people die. It's just traumatizing to watch so many people die, and they're not even allowing their loved ones can't be there with them as they make that transition. So that who's there with them? It's the nursing staff and the hospital staff who are there holding their hands as they transition to the next life. And so, yeah, it's been terrible on the healthcare system. And that's one reason why we implore people to get vaccinated.
May I just piggyback on that to just give a scenario, if you all could just go with me for a moment to think about something. What will happen if all of the nurses and the doctors and those people who are taking care of people, if patients show up at the hospital and none of them are there? Or it's so few of them, it's like none of them are there. How would this society function if we have no healthcare workers? And this pandemic, think about it, 2 years going into the 3rd year, how much stress can the healthcare providers continue to take so that they can provide the quality care that Dr. Clark was just talking about? Patient to nurse ratio, patient to physician ratio, all of those things. What would happen if we showed up at the hospital and there's nobody there to take care of us? Because there's a breaking point.
So true. Truly essential workers you are. And the people who clean the hospital, the people who feed, everyone who is involved any way associated with healthcare is an essential worker. And you're heroes and sheroes. I understand that Dr. Dawson, you and Dr. Clark are founding members of the Black COVID Coalition. Can you tell us about that, please?
Yes, the Black Coalition Against COVID actually started back right after the pandemic in 2020 when it hit. And that group came together, and it consists of the 4 historical Black medical schools. That is Meharry, Howard, Morehouse, and grew out in California. And the National Black Nursing Association, the National Medical Association, and the Cobb Institute, a foundation that goes with that. And we primarily came together to be the voice for the African American community, so that we could have some one-on-one conversation, so they could see scientists, physicians, and nurses that look like them. And it was very important for us because I had 2 of my best nurse scientists that was actually on the CDC task force, even under the Trump and the beginning of the Biden administration. So they were able to look into the science, to understand what was happening. And we were able to get out there and really lean in and let people ask us questions and bring together those thought leaders, those medical doctors, bring in those individuals that was from the CDC and others, and just have some open town hall conversations the same way we're having tonight. But allow people to ask us questions. And if we didn't know the answer, we said, we'll get back with you. But again, trying to pull in and say, no, it's just not someone who's not living in your community or going to church with you. We are there with you. We've been there all the time, but now we recognize you need to hear from our voice. We was trying to, again, dispel some of the myths that was going around. No, please do not take Clorox and all that other stuff folks were trying to tell you to take. You know, so we were really just down to earth, out there talking, and we continue to meet. But I will tell you that through that group, and we also had the Urban League was a part of the group, and the platform that we were using was blackdoctor.org. And so they loaned us all of their technology and all of the background. They helped us pull this off. And so there was many times we would actually maybe have 300, 400, 500 individuals listening to us. But more importantly, once blackdoctor.org uploaded the recording, we might have had another, 100,000 that was listening. So we have really probably reached over, 6 or 7 million individuals just by being out there. And every time this pandemic would turn, we would also turn with it. So that, when it was time for the vaccine to roll out, we jumped right on it. When it was time for us to talk about this from the pediatric space, we were there. We did a manifesto even with many other of our colleagues. So just being out there and being the voice was so important for us to be able to come together. And what I really loved about it, Dr. Reed Tutson, he took the lead on this, but there was many times when the rest of us, for example, when schools was getting ready to open back up, I was able to go to the National Association of School Nurses and get their leader to come in and speak. So it was all about individuals coming together and knowing how to get the right person in the right place at the right time for the conversation.
Great. Dr. Clark, I want you to talk about that, but I also want you to talk to us about building up the immunity and natural immunity and what that is and how it affects us.
So yeah, let me quickly add on about Black Coalition Against COVID. I'm one of the co-founders along with Dr. Tuxson. And so there are 2 levels on which it functions: the policy level that and the webinars, the very large webinars that happened that Dr. Dawson mentioned. But there's also a grassroots component to it. It's composed of faith leaders, leaders from the labor community, the education community, the artistic community. So, and what we've been doing ever since April of 2020 is working with trusted messengers from those communities in the faith community, a huge piece of it, and working with trusted messengers to get messages out to the community around keeping safe. And then when the vaccine came along around vaccinations, we had competitions, for example, to have young people make videos about why it's important to mask. We have stood up something called the virtual health ministry amongst the faith community in the DC metropolitan area, where they were doing outreach calls and doing assessments of individuals to see what kinds of services they needed, and doing warm handoffs to social workers at Howard University or to doctors if they needed a doctor. And so there have been just a lot of probably too many things to mention that Black Coalition Against COVID has done. And also me being a member of it through my media company, being able to contribute the Debunk. So if you go to Black Coalition Against COVID.org, you can see a lot of information that you might want to know just about COVID. You can watch videos, you can get links to other websites, etc. And then as far as the natural immunity, a lot of people say, well, I'm just going to take my black seed oil and my vitamin C and my vitamin D and my sea moss, and I'm going to be fine. And, it's super important to take care of your body and to be as healthy as possible, because we do know that individuals who are obese or have high blood pressure, heart disease, cancer, and other underlying chronic conditions are at higher risk for poor outcomes against COVID. But the thing about only doing those things and managing your health, it doesn't build antibodies in your body. Antibodies are your body's defense against infection. And the antibodies, our bodies are so beautiful. They make these antibodies against the specific virus so that when that virus comes at you, you can immediately take it down. And there are only two ways to build antibodies: get vaccinated or get infected. If you get infected, you could die. If you get infected, you can pass it on to other people. So the safer way to build antibodies is to get vaccinated, because you're not going to pass it on to other people. And there's way less of a chance that you'll end up hospitalized or end up dead. Or another piece that we haven't talked about at all, get long COVID, because we do know that somewhere between around at least 1%, okay, of the millions of people who've gotten COVID in this country, I think over 70 million now, 1%, that's 7 million, are going to end up with long COVID. You don't know if that's going to be you, because it could be people who had no symptoms when they got the infection, or it could be people who were hospitalized and almost died. It could be the entire spectrum. And long COVID, really persistent shortness of breath, brain fog, amnesia, cough, lack of energy, weakness. Don't want to go there. And so vaccination also cuts down on your risk of getting long COVID as well. So again, the black seed oil, the vitamin D, the vitamin C, fine. Those are wonderful things to help your personal health, but it doesn't protect against long COVID. It doesn't protect against spreading the virus to other people. And it's not proven necessarily to prevent hospitalization and death.
Well, thank you. I don't know what happened to the time. It just seemed to just fly by. And I know we could sit here and talk for much more than we've done this evening. And I can't tell you how much I've enjoyed talking to you, how much I've learned, and I'm sure our audience will learn from you, and look forward to one day where we can just hug our healthcare workers without fear of COVID. And I want to thank you so much, all of you this evening, for being with us and sharing this valuable, valuable information about preventing COVID in our community. Thank you so much, Dr. Clark. Thank you so much, Dr. Dawson. Thank you so much, Dr. Killian. You're wonderful. We appreciate you. And we will march on and try, and I will try and be patient. The next relative that is not vaccinated, and listen to where they are. So thank you. Have a wonderful evening.
You do the same. Thanks for having us.
Thank you.
Thank you so much for having us. Have a great evening.
Thank you so much to our panelists, and thank you for joining us this evening. We hope that you learn much and that you will help save your life and the lives of your loved ones. Have a good evening.